www.nashvillehumane.org.
The home healthcare industry is one of the fastest growing in the medical field, and it will continue to grow as the baby boomers continue to get older. JW Carell is the founder and chairman of CareAll Home Care, and he's joining us right now. You guys have been in business for 20 years, and you've seen a lot of growth over the years, haven't you?
Yes. And I'm 70 years old, soon to be 71.
Congratulations.
So we had no idea. In fact, we double in revenue every 2 years.
Which means you're doubling the number of people that you're serving,
Yes.
I'm sure.
Yes.
Yeah, yeah.
And today we serve, I think it's 3,000 people. Just in the Medicare part, we make 1,000 home visits a day.
Wow.
On the TennCare program, we bill them rather than by visit, by hours. And we're billing them for 29,000 hours a week. We have 1,000 employees, and I've got to have 2,000 in the next 3 years.
Is it mainly because as all the baby boomers are aging and are needing some extra help at home, or
Yes.
you do a variety of different things though for home health care?
Yes, we do infants. We've even had in the last year a couple of crack babies. They had to be seen, handled 24 hours a day for a couple of 2 or 3 weeks to get them weaned.
Yeah.
We have people that are paralyzed, all ages, and of course with TennCare, it's restricted to, it's affected by the level of income, or they're uninsurable.
Wow. And
there are literally hundreds of thousands of those people that are eligible. So we do physical therapy, occupational therapy. Sometimes just have to go in and bathe the patient.
And it's more than just the physical relationships, too. I get a sense that your folks really bond with the folks that they care for.
You know, our advertising, we say we have to have caring people. And that's the beauty of this business, is that, you know, if you're in the hospital setting, if the nurse's name wasn't written on a chalkboard, you wouldn't know who she was, and if she didn't have a chart on it, she wouldn't recognize who the patient, wouldn't know who the patient was. But these caregivers become part of the family. They go to the funerals, and if you think about it, for a person that's been poor health for some time, that caregiver is the only person they see all week.
Yeah.
That's not an immediate family, so yeah, there's a lot of, they get a lot of satisfaction.
It's an important relationships. And you're looking for people who are wanting to care for others who have some medical skills.
Yes. And for those who don't, if they have an aptitude, we've instituted a new program. We realize we're going to have to train people. The market's just not going to give us enough. So we're going to have to, we have a relationship with the medical educators. And of course now with this online, that's helping us. In fact, we just introduced a program where if they're staff people, let's call them office people, we'll pay them for their schooling to be an LPN or an RN.
Wow. We've
got RNs who just have the RN part, but don't have the BS. So we'll help them get their BS and get their master's.
So it's a great employment opportunity. It's also a great service that you're offering to the community. And we thank you so much for being with us today. If you'd like to find out more about CareAll, you can go to our website at newschannel5.com. We'll link you to careallinc.com.